Anyone can catch tuberculosis. Anyone who breathes can catch tuberculosis because tuberculosis is caused by a Mycobacterium tuberculosis, which is a very small bacteria. And this bacteria is in the air. Anyone breathing it can go to the lungs and get infected. But not anyone infected with TB will develop the disease because we have our immune system will contain tuberculosis. Having said that, if young children or old people or people with stress or not enough nutrition, these all will cause the possibility or HIV infection, for example. These people are more prone to have infection to the disease, which is active tuberculosis because. In fact, 1/3 of the whole world population are already infected with Mycobacterium tuberculosis. And all diseases are not a new one, has been here for many years and will be here for many years until we find the very good vaccine and break the transmission cycle. Yearly, about 500,000 people get tuberculosis in our region. That's actually about 1,000 people every day. And unfortunately, about 40,000 people die of tuberculosis every year, which is really unfortunate and it's not acceptable. The symptoms of TB starts often very like general symptoms like fever, night sweats, or weakness, general weakness, and that's actually the problem because many patients do not think that they may have TB. Even healthcare facilities, you refer to them, they say maybe it's a common cold. So the symptoms at the beginning is just very similar to any other respiratory disease, and that makes the problem because the diagnosis can be delayed, and the infection can continue. The transmission of the infection can be continued in the communities. But anyone more than three weeks of cough and sputum, we highly recommend that physicians think about tuberculosis because early diagnosis is extremely important. TB affects lives in many other ways. It's not only health issues but also social aspects because someone who is already ill with TB obviously want to protect his surrounding and people around him, so he'll have less communication with the people around him. On the other hand, in terms of income is a problem because often TB treatment is long. The shortest treatment we have is 6 months, but if it's a drug-resistant TB, which is quite common in our region, up to 2 years. That means that for 2 years a person often is out of job, which is not a good thing, and of course in terms of income they have problem. On the other hand, is also stigma. So once someone diagnosed with TB from the community side, they think that TB stays always with the person, which is not the case. Once the person is cured, it's completely normal to come back to the society. And the other thing is that we have 2 phases of treatment for tuberculosis. The first phase when the person is infectious, and the second phase, the person is not infectious or very less likely to infect others. Having said that, the treatment is long. But after starting the treatment, very soon the person is no more infectious. But it's very difficult to explain this to the community, and the people are very afraid of that person, and that's makes a stigma of tuberculosis. TB mostly affects, in our region, the young adults, but also can affect anyone, as we mentioned, even children and then also old people. But in our region, mostly we have the TB among the young males and also old people in the Western Europe countries. People who are moving from one country to another, migrants particularly, are also prone because of the stress that they have, also because of the rate of the TB in their home country. So they are also more prone for having tuberculosis. TB affects actually the most vulnerable part of the communities, those who are marginalized, particularly in the big cities, and also people who are in the poverty, so or prisoners, obviously. These are the groups that are more vulnerable to tuberculosis, and this is, as I mentioned, because of the not only for transmission of the infection, but also from development of the infection to disease. So they are more prone. So actually, it hits the hardest the poor. Mycobacterium tuberculosis is actually a very clever bacteria. It can adapt very well to environment. Even harsh conditions it can survive because a very thick cell wall it has. but on the other hand also has different population of mycobacterium. Some of them are in the sleeping mode, some of them are replicating, some of them are in within the immune cells, some of them are out. So that makes it very difficult for treatment. We need to have several drugs to be given to the patient at the same time. And if for some reason some of the drugs are not given to patient, or patient is not taking that drugs, mycobacterium can develop resistance to the drugs that they've been receiving. So in that sense, the resistance of drugs is, we call it amplification. So become more resistant to the drugs that we have. And that's what we have a problem in our region, more than any other region. In fact, we have 20% of the whole world multi-drug resistant burden in our region. Multi-drug resistant is a type of tuberculosis where the two most important drugs are not anymore effective for that strain. We call it MDR-TB. In our region, we have about 75,000 multi-drug resistant tuberculosis every year, which is quite high. And some of the countries in our region, particularly in the east, have quite high percentage of MDR-TB among the TB cases, up to almost half of the cases, in some cases more to 70% of the retreatment cases, and 30% of the new cases are multi-drug resistant tuberculosis. Treatment of multi-drug resistant tuberculosis is very difficult, complicated, takes 2 years to treat patients, and up to now the success on average is 50%. So unfortunately 50% do not respond to treatment. Having said that, we have some settings where they have also reached 80% of treatment success for these patients. So extremely important to know which type of mycobacterium we are dealing with. So very important to do appropriate tests to adapt the treatment accordingly and make sure the treatment finishes correctly. The most important issue is awareness. So anyone who has symptoms should refer to physicians. More than 3 weeks cough, please do go to your physicians. Maybe it's tuberculosis. The second item is that physicians and healthcare workers should think of tuberculosis if someone refers to them with these symptoms, which is often the general symptoms, but taking account the risks, we should always consider it. Then the next steps is, of course, appropriate diagnosis and fast diagnosis. Up to now, we've been using, in fact, very often sputum smear microscopy, meaning looking at the sputum sample under microscopy or doing the culture. But since 2010, a rapid diagnostic test has been approved by WHO. This is actually revolutionary, which is based on molecular techniques, and it can give answer within 90 minutes, telling whether this person has a Mycobacterium tuberculosis or whether this is a drug-resistant, particularly MDR-TB. So that's a complete revolutionary tool that is already available, but not all the countries have access to this tool. We really recommend countries to embark and scale up this rapid diagnostic of MDR-TB and TB in our region. So health system should adapt to the patient's needs. As we mentioned, treatment is long, and it's not acceptable for the patient to stay always in the hospitals. Apart from the cost that it has on the health system, it's not patient-friendly. As you mentioned, not all the patients need hospitalization. So what we recommend to all member states to do, to make sure they have a very good ambulatory care, meaning that the patient can come to get the treatment in the primary health care services, meaning that you have an adapted system like a mobile clinic going to the patient's place, giving treatment there, home visit and so forth, or member of community where you can get the treatment, facilitated treatment. It's often very easy for the patient to stop treatment because after a while they feel good, and that's where the problem starts. Once they feel good and they don't get the treatment, the disease will come back again. So we should make sure that treatment is fully finished and is as in the patient-centered approach. So health systems need to be more flexible, providing services in the different facilities or ambulatory or home care. And on the other hand, we also need new tools. The drugs that we have are very old, almost 50 years. This year, most probably one new drugs will be added, but even if you do not take care of that one drugs, we will also lose a battle because the resistance will develop. So very important to have a comprehensive support for the patients. There should be also some social support for the patient, helping the patient finish the treatment appropriately. So the services should be patient-friendly. There's also a need for new research and development for new drugs, vaccine, and more patient-friendly approaches overall.